Good evening, folks. I have discussion C for you already set up to go. So here we go. We dive into ageism in healthcare is a $63 billion problem. An expert offers 8 ways to combat it. Okay, so here we go with the presentation. The problem, ageism in healthcare. Ageism is a widespread but often overlooked form of discrimination in medical settings. It affects the quality of care older adults receive, leading to misdiagnosis, poor treatment plans, and loss of patient autonomy. Common examples include dismissing symptoms as normal, aging, speaking to family members instead of the patient, using prioritizing language, sweetie dear, spending less time with older patients. The financial impacts. Studies from Yale School of Public Health estimate that ageism contributes to an additional 63 billion annually in healthcare costs. These costs stem from 8 major conditions, including diabetes, heart disease, and cancer. Experts' insights. Mark Brennan, Brennaning, and Marilyn Lucci emphasize that ageist practice rob older adults of agency and dignity. When you put a elder person down using ageism, for us, for regular people, it's like terms of an endearment. But for an elderly person, when you call them honey, sweetie, it's putting them down. It's called ageism. Okay. It's a, it's a form of discrimination. Okay. Mark Brenning and Marilyn Gallucci emphasize that ageist practices rob older adults of agency and dignity. Andrew Stewart highlights how even well-meaning providers, many unknowingly, perpetuate ageist behaviors. Solutions offered. Well, the article mentions that an expert offers 8 ways to combat ageism. The full list isn't detailed in the visible portion. However, the emphasis is on educating health care professionals, promoting respectful communication, ensuring older patients are treated as active participants in their care. If you'd like, I can help you explore specific strategies to reduce ageism in healthcare or dig deeper into the 8 solutions mentioned. Here are the 8 experts recommended strategies to combat ageism in healthcare as outlined in the article. Educate health professionals. Train providers to recognize and challenge their own ageist assumptions. Include ageism awareness in medical and nursing schools curricula. Communicate respectfully. Avoid patronizing language like sweetie or dear. Speak directly to older patients, not just their caregivers or family. Focus on the individual needs. Treat older adults as an individual, not as a non monolithic group. Tailor care plans based on personal health status, not age alone. Spend more time with older patients. Allocate sufficient time for appointments to understand complex health issues. Avoid rushing or minimizing concerns due to assumptions about aging. Improve referral practices. Ensure older patients are referred to specialists when needed. Don't assume they won't benefit from advanced treatments or therapies. Promote patient autonomy. Involve older adults in decision making about their care. Respect their preferences and values, folks. Support research on aging. Invest in studies that explore aging related health issues. Use evidence-based practices to guide treatment. Advocate for systematic change. Push for policies that address ageism in healthcare systems. Encourage institutions to adopt age-friendly practices. These steps aim to restore dignity, improve outcomes, and reduce the struggling $63 billion annual cost linked to ageist practices. If you'd like, I can help you explore how these strategies could be implemented in a specific healthcare setting or profession. Ageism in healthcare is Ageism in healthcare has a profound and far-reaching consequences, not just for older adults, but for the entire system. Here's how it affects outcomes: mental and emotional health, increased depression and anxiety. Older adults who internalize negative stereotypes about aging are more likely to experience mental health issues, reduced self esteem and autonomy. Being treated as incapable or irrelevant can lead to feelings of helplessness and social withdrawal. Physical health and treatment quality, delayed or denied care. Ageist assumptions often result in older patients being overlooked for aggressive treatments or specialties referrals. Guys, before I go on, I'm going to put my 2 cents into this portion of the show. Treat elderly like you want to be treated. Don't downplay their their age or their disability. To them, don't treat them like babies. Treat them like normal human beings, please, guys. Okay, shorter life expectancy. Studies show that older adults who absorb negative age stereotypes tend to live shorter lives. Inappropriate treatment plans. Healthcare providers may base decisions on age rather than individual health status, leading to undertreatment or overtreatment. Systematic and financial impact. Higher healthcare costs. Ageism contributes to an estimated $63 billion annually in excess medical spending due to misdiagnosis, poor care coordination, and preventable complications. Reduced participation in clinical trials. Older adults are often excluded from research, limiting the development of age-appropriate treatments. Barriers to access. Avoidance of care. Older adults who feel disrespected or dismissed may avoid seeking medical help altogether. Structural discrimination, from appointments, scheduling, systems to signage and messaging. Subtle cues can make older patients feel unwelcome or undervalued. In short, ageism isn't just a social issue, it's a clinical one. It undermines trust, worsens outcomes, and inflates costs. If you're interested, I can help explore how specific interventions like age-friendly health systems are working to reverse these trends. Ageism can quietly erode mental health in older adults, even often in ways that go unnoticed but have serious consequences. Here's how it plays out. Psychological toll of ageism. Depression and anxiety, repeated exposure to ageist attitudes like being dismissed, ignored, or stereotyped can lead to chronic stress, which fuels depression and anxiety. Internalized ageism. When older adults begin to believe negative stereotypes about aging, e.g., I'm useless or it's normal to feel this bad, it worsens their mental health. This internalization can lower self-worth and increase feelings of hopelessness. Social isolation. Ageism often results in older adults being excluded from conversations, decisions, or social activities. This isolation is a major risk factor for mental health decline. Therapeutic therapeutic nicheism. Some mental health professionals assume older adults are beyond help, leading to poor therapeutic engagement and fewer treatment options. Scientific models that explain the impact. Stress processes stress stress process model. Ageism acts as a chronic stressor, triggering a cycle of emotional distress and mental health issues. Stereotype embedment theory. Over time, older adults absorb societal beliefs about aging, which shape their expectations and behaviors, often leading to self-fulfillment, declines in mental health. Real world consequences. Older adults with negative views of aging have been shown to live up to 7.5 years less than those with positive outlooks. During COVID-19 pandemic, ageist messaging and intensified feelings of vulnerability and loneliness among older populations. In short, ageism isn't just a social slight, it's a mental health hazard. If you're curious, I can show you how geriatric psychiatric clinics and aging programs are working to reverse these effects. Yes, there are several compelling studies that link ageism to cognitive decline, showing how negative stereotypes and discrimination based on aging can have measurable effects on brain health. Here are some key findings. Everyday ageism and cognitive function. A systematic review published in Innovation in Aging found that everyday experiences of ageism significantly worsened cognitive functioning in older adults. This includes subtle forms of discrimination like being ignored, patronized, or excluded due to age, to epigenetic aging and memory decline. A study from the University of Virginia used epigenetic clocks to measure biological aging in identical twins. It found that twins who age faster biologically also experience greater decline in memory and thinking skills by midlife. Importantly, those from lower socioeconomic backgrounds who often face more ageism showed stronger links between aging and cognitive decline. Linking discrimination to brain health. Research has shown that internalized ageism, when older adults believe negative stereotypes about aging, can lead to increased stress, reduced self affectancy, poor health behaviors, all of which contribute to accelerated cognitive decline over time. Alzheimer's, biomarkers, and ageism. A study published in neuropsychology found that older adults with mild cognitive impairment or Alzheimer's disease showed steeper declines in cognition when they had higher levels of amyloid anti-U proteins and GAU proteins. While not directly about ageism, the study suggests that early life disadvantage and discrimination may increase vulnerability to these biological markers. In short, ageism isn't just a social issue, it's a biological and psychological one that can literally reshape how our brains age, reshape how our brain ages. If you'd like, I can help you explore interventions that have been shown to protect ageism as a deep and damaging impact on mental health, especially for older adults. And it operates on multiple levels: psychological, social, and systematic. Here's how it plays out. Psychological effects. Depression and anxiety. Ageist attitudes like assuming older adults are frail, forgetful, or irrelevant can lead to chronic stress, which fuels depression and anxiety. Internalized ageism. When older adults absorb negative stereotypes about aging, they feel worthlessness, hopelessness. This self-stigma worsens mental health outcomes. Reduced self-esteem. Being treated as less than because of age can erode confidence and a sense of purpose. Social isolation and loneliness. Exclusion from social roles. Ageism often sidelines older adults from meaningful activities, work, or decision making, leading to isolation. Invisible in society. Many older adults, many older individuals report feeling ignored or dismissed, which contributes to loneliness, a major risk factor for mental illness. Clinical and therapeutic barriers. Some mental health professionals assume older adults are beyond help, resulting in poor engagement and fewer treatment options. Misdiagnosed, underdiagnosed. Depression is often mistaken for normal aging, leading to missed opportunity for care. Biological and cognitive impact. Stress process model. Ageism acts as a chronic stressor, triggering a cycle of emotional distress and cognitive decline. Stereotype emboli- em- embodiment theory. Lifelong exposure to negative age stereotype can shape behavior and biologically accelerating mental and physical deterioration. Global mental health inequity. Ageism contributes to unequal access to mental health care worldwide. Older adults are often excluded from clinical trials. Public health campaigns and resource allocation. In short, ageism isn't just social slight, it's a mental health hazard. Tackling it requires not just awareness, but systematic change across healthcare, media, and policy. If you'd like, I can show you how geriatric psychiatry clinics and aging programs are working to reverse these effects. Cognitive health in the face of ageist environments. Okay, guys, so that is it for tonight. I will be on tomorrow for shows. Until then, Gator Wellness. Take care, folks. Have a good evening. See you tomorrow for shows.